Greetings, loved ones. Today we're going to continue talking about the basics of elder abuse. Help us get these messages out. Please subscribe to our channel. Follow us on Facebook, Instagram, and Twitter. Hit the like button and the notification bell, and please share these messages with others because you never know, just by doing so, you could save a life. So, we're going to start out again. What is elderly abuse? The World Health Organization defines elder abuse as a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust which causes harm or distress to an older person. Elder abuse occurs in many forms. There's elder neglect. This refers to the failure of a responsible caregiver to meet the medical, social, and or psychological needs of an older adult who requires assistance in one or more of these areas. Withholding essential needs. Withholding of essential food, medicines, general medical care, such as not taking the person to the doctor, that the older adult cannot perform themselves. There's failure to provide assistance. Failure to provide basic assistance to an older person who cannot self-perform daily living tasks like bathing, feeding, dressing, or even going to the bathroom. Then there's a missing caretaker. Caregiver neglect implies the identification of a person responsible for the care of a vulnerable older adult and that person's unwillingness or inability to performing caregiving responsibilities. So why does elder neglect occur? Neglect is a relatively common form of elder abuse because older adults have a higher prevalence of medical conditions and functional limitations that render them vulnerable to neglect. First, it could be intentional. Elder neglect may be intentional, such as when a family member just chooses to withhold food or medicine from an older person. Or the caregiver may be unable to provide care. It can also be unintentional, such as when a caregiver responsible for an older person is themselves disabled, mentally ill, or too frail or weak to provide assistance. What harm can elder neglect cause? The type of harm depends on the type of needs that are neglected. First, it can kill. Older adults who are not provided with their medicines or taken to the doctor will develop worsening of their chronic medical conditions like diabetes or heart disease that can lead to complications, hospitalization, or even death. Then there's malnutrition. Those who are not fed will lose weight and become malnourished. Then there are hygiene-related health problems. Patients who need assistance with daily tasks such as bathing and turning in bed can develop bed sores or health problems related to poor hygiene like urinary tract infections. So what can be done to stop elder neglect? Like other forms of elder abuse, stopping it will depend on the type of neglect and its causes. So there's helping caregivers. Neglect that occurs because caregivers are simply overwhelmed will require other family members or paid caregivers to step in. Social workers can often determine if Medicare, Medicaid, or private health insurance, especially long-term care insurance, can pay for these services. There can be interventions for intentional neglect. When it's intentional and resulting from mental illness or other problems in the caregiver neglector, interventions are more complicated and involve things like psychiatric referral and substance abuse counseling. So, handling of extreme cases. In extreme cases, the only viable and safe option may be to move the neglected older person to a different living environment, such as assisted living or a nursing home. According to the WHO, 1 in 6 seniors above 60 years of age will experience abuse. The question is not if you'll encounter abuse or a victim of violence. The question before God is, what will you do when you do encounter them? You could be the person who saves a life. You are called, we are all called to be champions for justice, and those who suffer violence need to know that those who love them and those who don't even know them will reach out and step out to give them the help and the courage they need to leave before it's too late. Help us get these messages out. Please subscribe to our channel, follow us on Facebook, Instagram, and Twitter. Hit the like button, hit the notification bell, and please share these messages with others. You never know, Just by doing so, you could save a life. If you are a victim of violence, if you're suffering elderly violence, we want you to know that you are loved, you are valued, you are intelligent, you are beautiful, and God does not want you to suffer violence. He wants you to live free from violence in peace and tranquility. There is a way out. It's not your fault, and abuse is not love. If you're a victim of violence, reach out to someone. If you find yourself in a dangerous situation, call 911 for help. If you know of a senior suffering violence, tell the authorities. In our next episode, we are going to talk specifically about the physical abuse of seniors. Until then, God bless you.